right, welcome everyone to the IPAK EDU Director's Science webinar. It is Monday, March 25th, and we are delighted to be joined by Jessica Hockett and Jonathan Engler for tonight's talk on what happened in New York. As always, we'd like to say thank you to everyone for tuning in to the live talk here tonight, as well as the recording if you're seeing it later. And of course, to our subscribers, and most of all to our presenters like Jessica and Jonathan, without whom none of this is possible. So thank you, and it's not easy changing the world, but it's more fun doing it with you. The science webinar comes to you every Monday at 7 p.m. Eastern, and you can always get an update at ipac-edu.org/science-webinar. Tonight's course highlight at IPAK EDU is the Microbiome Master Course. It's beginning in June and is going to run through the summer of 2024. And this is your opportunity to dive into the world of the human microbiome. I believe this is the third time this course is running, and it's team taught by people with a range of expertise coming from different perspectives. And you're going to learn about the microbiome and how it interacts with our biology, with the bacteria that's both within and without us, and viruses as well. Lecturers will include Dr. Bruce Stephen, Dr. Henley Ely, Dr. Jack, Dr. James Neuenschwander, Dr. Michael Gaida, Dr. Randall Gates, and Sarah Woods-Kender. And that class is going to meet every Wednesday at 12:30 p.m. Eastern, and you can learn more at ipac-edu.org. So I've taken this course twice before, and it's very interesting. It's updated every year. So if you're interested at all in it, and I hope you are, please go to ipac-edu.org and register. Next week, Monday, April 1st at 7 p.m. Eastern, we'll be joined by Alexis Baden-Meyer of the Organic Consumers Association. And she has been assembling information regarding the fate of farming. And her talk is entitled The Plot to End Farming. And she writes, for the last 130 years, world leaders, including Hitler, Churchill, and FDR, have partnered with scientists and their funders, eugenicists like Rockefeller and Ford, to weaken the economic and political power of farmers and drive them out of business. In the US, we're down to 1.9 million farmers, and that isn't the invisible hand of the market at work. It's all according to plan. If you're not ready to give up real food, you don't want to miss this talk. You can register for that at ipac-edu.org/science-webinar and hope to see you there. Tonight's quote, which we choose a quote every week that applies to the talk at hand. And this one is from Carl Sagan, and it has been referred to as, I believe, the Sagan Standard, although it's actually been used in concept by many scientists over the centuries. The quote is, extraordinary claims require extraordinary evidence. And I think you'll see how this applies once Jessica and Jonathan go through their presentation. Tonight, March 25th, 3 p.m. Eastern, we have Jessica Hockett and Jonathan Engler. And I am going to read a bio for both of Jessica and Jonathan, and then get underway with the talk. Jessica Hockett holds a PhD in educational psychology from the University of Virginia. She is an independent researcher focused on the COVID events in early 2020, with an emphasis on New York City and the death spike there. She spent more than 20 years in the K-12 education sector as a middle school teacher, online graduate instructor, and consultant to schools, agencies, and nonprofits. Her publications include numerous articles, reports, other academic and scholarly works, and several books. You can find her at Twitter at Woodhouse76 and Substack at woodhouse76.com. Jonathan Engler began his career as a medical doctor in clinical practice before moving into the pharmaceutical industry, where he gained experience in designing, running, and reporting clinical trials to regulatory standards. After a few years, he and a colleague set up a business to streamline clinical trials using IT automation. This company was sold to a U.S. corporation a decade later. Subsequently, he retrained as a lawyer and practiced for a short period before re-entering the healthcare business world. He is currently co-chair with Claire Craig of the UK-based Heart Group, which has voiced opposition to the UK government's policies of the past few years. He also serves on the executive committee of the international research group PANDA, where he works closely with Jessica. Jonathan has authored many articles for Heart and Panda, including Panda's recent position statements on COVID vaccines and the nature of the events of the COVID era. And with that, I give you Jessica Hockett and Jonathan Engler.
Hi, thanks
Welcome,
for having
welcome.
us.
Before we get started with your talk, could you, both of you, give us some context for how you came into this sort of COVID era space and asking the kinds of questions that you do, just to give people a feel for where you're coming from?
Well, as for myself, for a few weeks, I actually, did buy into the whole thing. I'm not one of those people who said it was I saw it as a government psyop right from the beginning. It took me about 6 weeks, I think, to come in. But there was one defining episode which made me realize everything about this is completely nonsensical, and that was that we actually Uh, we went out with our kids with these adult kids to an outdoor market where they sell food, and we all bought our food, and then we all sat on the edge of a sidewalk eating it, and the police came up to us and said, "You look like you're in a larger group than is allowed." At the time, we were only allowed to be two people or three people, unless you all lived in the same house, in which case you could all be together. Even though you're milling amongst hundreds or thousands of other people, this was the rule. And so we got out our driving licenses and said, look, we all have the same last name. And they said, no, that's not good enough. We actually need proof of your address. Where do you live? And I just thought to myself, this is just crazy. This is a bureaucracy gone completely mad. And once you see that a lot of what they did was a bureaucracy just on autopilot, going completely mad, then you start to doubt things, and then it opens up the world of doubt for you. And then the next major event was our health minister Matt Hancock in June 2020, in Parliament said, there was a debate at the time raging about whether or not they were going to open up society and let herd immunity take its course. I mean, all these concepts are faulty now, as you probably get from our presentation. And then but Matt Hancock said, no, we're not going to have a let it rip strategy. We're going to suppress this until the vaccine is available. And I thought to myself, well, famously, they never ever managed to create a coronavirus vaccine, and yet a vaccine takes years to develop. So what is he talking about? And that was another major sort of thing that piqued my skepticism. And so after that, it was all, uh, you know, every single thing they said to us is untrue. Was my working assumption
Mhm,
from that point on. Yeah.
mhm. Jessica, how about you?
Yeah, for me, I was living in Cook County at the time, Chicago, and in Evanston, Illinois. I thought it was just crazy from the beginning, not even so much because of the claims about a super spreading virus that was killing people, but because I thought the government was doing illegal things. When my governor, J.B. Pritzker, said the churches will close,
Mhm,
I was like, wait a minute, he can't do that. And my husband's in the restaurant business. They closed restaurants, and I was like, wait a minute, how is this going to work? I wasn't worried about the virus, but I was worried about the economy, and I was
mhm,
worried about the ecosystem of cities and
mhm,
what would happen, the economic ecosystem with everybody staying home. And so pretty quickly, I took to Twitter at first under an eponym, Emma Woodhouse. And I think it's fair to say I became known in Chicagoland and Illinois, and then maybe more broadly as something of a just anti-mandate, anti-mask folk hero, if
mhm,
you will. I tweeted and posted all the time about data from Chicago. I was reading the Cook County Medical Examiner's Register, each
mhm,
and every death, just studying. And the New York event, I'm not from New York. I don't live in New York, but I know New York. I've worked in New York. And that event, what happened there, always troubled me. And I think
Mhm.
I began tweeting about it more actively, maybe in 2021, 2022, especially saying what happened here and why doesn't anybody want to talk about it? Like, can we stop just saying, well, it was ventilators? Because I don't really see the data for that. And so that began a process of just independent investigation, submitting a lot of FOIA requests, doing a lot of reading, rereading. Jonathan and I did not know each other. I got suspended from Twitter for 5.5 months, but when I came back to Twitter, my account was restored at the end of 2023. Is that right? Well, no, 2022. I can't remember, but
22, I would think.
yeah, 22, end of 2022, very end. And yeah, just Jonathan and I think I had seen I had seen his Italy analysis, and I just noticed, we're saying this guy and I are saying the same things. We're saying asking similar questions, and we ended up getting connected and both involved with the group Pandata. And so yeah, we've been looking at this and some other early events of 2020 together for almost a year now, and we've noticed that very few people want to look at or talk about the early events of 2020, but we think it's really really important and fascinating. I think we see ourselves as historians of a kind at this point.
It's almost like forensic historians in a
Yep.
sense, data
Yep.
forensics. You know, it's interesting. And most people don't know this, but in Hawaii, we had a crazy rule where you could be on a surfboard in the water, but you couldn't be on the beach. You could be swimming, body surfing, but you couldn't be sitting on the sand, even by yourself on the beach. And I myself trained as an architect. We were given the same privileges almost as firefighters and police officers. Had a letter from our boss that if a police officer stopped you, for during this emergency, all you had to do was say, "Well, I'm essential. I'm an essential worker," and it tells you that the essential workers were really about economics rather than an emergency status. At least
Yeah.
that's how I perceived it. Um, I'm gonna let you get started with your recording. That's a very fascinating background, and I think everyone will enjoy the kinds of questions you're asking and where the data leads us.
Yeah,
Thank you.
we hope so. Yeah, we'll get started. We're going to save questions for the end. Let me come up to the presentation mode. Forgive me a second here. Jonathan and I have titled this talk, What Happened in New York City in Spring 2020. We have a good bit of content. There is a lot of data, a lot of graphs. So if you're a little overwhelmed, we certainly understand, but we're happy to answer some questions at the end. So be sure to write those down or take note of those or put them in the chat. The general flow of what we're going to be taking a look at is this. We're going to do some stage setting, a little bit of introduction, and take you back to the role that New York City played, or that we think New York City played in these early days of the COVID pandemic declaration. We want to give you a sense of the scale of the event of spring 2020, the biggest mass casualty event in New York City history, probably in US history as far as we can tell. And we're going to look at slices of the data through a lens that we find that people don't normally look at, even data analysts don't normally look at, and that is where people died, the place of death, hospital, home, a little bit with nursing home, to try to raise some questions about and point some things out about the event. And then we're going to talk about, as we close it up, whether this event happened to the extent that the US government claimed, and how we can try to figure that out, or even better, compel the government to prove that it did happen. So like I said, I want to take you back to spring 2020, and traumatic as that those days really are for many of us. But I want to take you back so that you can think about the role that New York City played in really launching the COVID-19 pandemic declaration. It's the biggest city in America, one of the most iconic cities in the world. You might remember scenes or reports of overflowing hospitals and doctors and nurses saying that they were under siege, reports about refrigerator trucks that were filled to the brim with bodies, the sound, some people said, of ambulances incessant 24/7. New York really, in a lot of ways, for launching this event of the pandemic, we think makes a lot of sense when you think about how people identify New York, even just the way that Hollywood, whether it's through, apes and monsters and asteroids and aliens, really has over time positioned, probably because of how iconic it is and all the symbols that are there of America and of freedom, but they've really steered into our collective consciousness, this idea that New York is a city under attack. Then, of course, we do have many real life attacks and events that have happened. The one I'm sure that comes to most people's minds is the World Trade Center disaster in September 2001, summer 2023. Even if we fast forward past the COVID-19 pandemic, we saw the city was attacked by smoke, right, in the middle of summer. So, arguably no city in the world, certainly not in America, is more disaster prepared or pictures itself as being a perpetual potential victim of attack. They run drills, they have all kinds of disaster preparedness efforts. It's also, this maybe goes without saying, but it's also the home to influential media, news reporters. We have the UN headquarters there. The UN oversees, or the WHO is an agency of the UN. So really, it should come as no surprise that New York City was placed center stage in March 2020 for the COVID-19 pandemic, and that it's alleged, really even still today, that the city was attacked by a virus in a way that virtually no other city, certainly in America, was. The event itself is pretty spectacular to behold. This is daily deaths, all causes, all ages, from the beginning of 2019 through the end of 2020. And Jonathan and I have taken a look at different slices of this data, but what we see from this view is that there's absolutely nothing going on in all-cause deaths until after March 16th, which was the day that the federal government declared that there would be 15 days to slow the spread. And then we see an incredible base to peak rise, skyrocketing of deaths from about 150 or so a day to a peak of 1,200 deaths in a single day. And then incredibly, we see it drop back to baseline by the end of May and not really do anything until the end of 2020, until after the COVID shot is being distributed. And even then, we don't really see it creep up that much. So it's really a spectacular event to behold. When we look at COVID-blamed deaths versus not COVID-blamed deaths, we see something even more puzzling in some ways. We see something that looks like a bomb going off, a virus bomb, and then we have all those deaths. We have about 20,000 or so deaths that blame COVID-19 as underlying cause that happen within a very short time frame, and then they virtually go away for the rest of the year. We also see non-COVID deaths happen in a very short period of time. The non-COVID excess event was actually shorter than the COVID event. But for the rest of 2020, after about 6 weeks or so, we don't really have non-COVID excess either, which is very different from a lot of places. And when you think about the continuing lockdowns and mitigation, some of the civil unrest of summer 2020, late spring 2020, it's pretty interesting. It's pretty puzzling, actually, to see that. Another pretty spectacular thing that we see in New York is with adult age group deaths. As we might expect, because we were told that COVID-19 affected largely elderly people, we see with again, with 15 days to slow the spread, we see a skyrocketing of deaths among elderly or older adults. But then, unlike pretty much any place else in the world, we also see a very significant rise in younger adult deaths. Now, do note that the axis, the y-axis on the side is a different, it's different, right? Those numbers are lower. But still, we see really a simultaneous rise and a significant jump in excess death in all age group that virtually goes away after spring of 2020. Even now, the official story regarding this New York City event, when people do talk about it, because people don't talk about it that much, there's a lot of silence around the event, we think. But the official story goes something like this. New York City got hit harder than virtually any place else by a coronavirus or a variant thereof. They didn't know how to handle the virus. Everything was new, but they learned really quickly. And the rest of the country, really the rest of the world, learned from New York's experience. They took the hit first, and then they showed the rest of us how to handle it. And a lot of times the virus, or excuse me, the toll there is blamed on a certain policy called, I just call it the nursing home policy, but regarding COVID positive patients that were allegedly sent back into hospitals, and then they spread the virus and they killed everybody in the nursing homes. So there is acknowledgement that there was a high death toll, but a lot of times it's blamed on that or on ventilators, on early intubation. Mistakes were made. This is something that Anthony Fauci will say when he says anything about New York. Mistakes were made, but it would have been worse, right? We caught it just in time, and we learned a lot of stuff. But thank you, New York. Andy Slavitt, some of you might know who this is. At the time, Andy Slavitt is actually the architect of the Stay Home, Save Lives messaging campaign in the U.S. that launched on March 16th. He has some other interesting background as well, but even he said at the time, now this was the summer, but the only thing as steep as New York's rising curve was their falling curve. It was spectacular and historic, and that is a credit to New Yorkers, to discipline, to community, to respect for the medical workers. So, this event, which I've come to think of as a very much a staged event, we were all supposed to applaud, not stand back and say, what the heck just happened there, but applaud New York. Andrew Cuomo, you might remember, got an Emmy that was later taken away, but an Emmy for his performances really during his press conferences. And there really hasn't been a lot of accountability for even just explaining what happened there. Our pushback, our general pushback on that story goes something like this. Jonathan and I would say, there's really not a lot of evidence that coronaviruses would hit like that. They aren't bombs. What you see in New York City, that spike, if you didn't know what that was attributed to, you might say like, okay, that's an earthquake and some aftershocks. What the heck happened there? But not a coronavirus. We don't see any sign of a risk additive pathogen silently spreading before that 15 days declaration. We don't think that that's been proven whatsoever, that there was something creeping and then went off like a bomb. We believe that most, if not all, legitimate excess deaths were iatrogenic and caused by the response. And we don't think that there's available data that allow not only primary blame to be placed on a nursing home policy, but a lot of the things that people tend to blame the toll on. And we hope that'll be more clear as a result of what we're talking about. There's an error with this slide. Forgive me, but oh no, there's not. I'm sorry. There's not an error. This is the next section. But we find that people don't really still truly grasp the scale and the magnitude of this event. So we want to take you through just some comparisons so that maybe you have a sense if you don't already. Last year on Twitter, I put it like this to my followers. I said, hey, say there's a city that normally experiences 4,000 deaths in a month. If that number for that month jumped to 25,000 deaths, what would you think occurred? And it's interesting to look at people's responses to this because some people had no idea that I was talking about New York City or that I was talking about something that is alleged to have occurred. And they said all kinds of there's some funny things, but all kinds of things like a bomb, a war, an earthquake, a tidal wave. But in fact, that's exactly what the government is claiming occurred in New York City. And I like to make this comparison of the Aprils. If you go back to 2008, although it would be similar if we went back even further, April 2020 saw an additional 20,000 deaths in a city that normally experiences about 4,000, 4,500. 8.5 million people in New York City. People think, 20,000 deaths, is that a big deal? Yes, it's a big deal compared to its own baseline. If we look at daily deaths, all causes, going back to 1999, the World Trade Center still stands out as the deadliest single day of deaths occurring in New York City proper. There was some of you might remember there was a plane crash that happened in November in Queens that happened a couple months after. That's what this is. Back here, we see some heat wave deaths in 1999, but the COVID-19 event stands out insofar as sheer numbers. We're talking about 10 times the World Trade Center disaster in mortality. Here's an illustration of that. This bar chart goes from 15 days to slow the spread on March 16th all the way just through the end of April. And I'm trying to show in terms of World Trade Center deaths, which were about 2,700, how many equivalents of that number of casualties are claimed to have happened in a very, very short period of time. 15 days to slow the spread. At the end of that, we had the rough equivalent of one World Trade Center disaster. Not long after, another one. Few days later, another one. Few days later, another one. It's truly unbelievable to think about. Here's another view of the same idea, just the deadliest day since 1999 in New York City history. Again, World Trade Center still stands out as being the highest, and that also includes just regular, normal deaths that happen on that day, not just the World Trade Center event. But when we look at and think about the number of bodies that would have had to have been or that are claimed to have been handled in April and March, it's simply astounding. When we go back further to compare New York versus New York to the storied 1918 flu pandemic in October 1918, we see that the 2020 event is twice that in scale. The speed too was faster, a bit faster than it is claimed to have been in October 1918. This was all-cause mortality in both cases, not just blamed on whatever respiratory pathogen. But it's truly amazing when we look back at this and think, wow, there's not really been a lot of answers or talk about this for the scale of the event. When we look at New York City versus another city in the United States that is demographically comparable, even though it's a smaller city and a little less dense, Chicago is a pretty staggering comparison. I didn't population adjust this because I wanted you to see each city relative to its own baseline. So New York increased about 700% base to peak, whereas Chicago had a little bit longer or drawn out event, and its peak was about 100%. What's interesting about this is Chicago actually identified the second and third cases in the nation, in the United States, in the third week of January, end of the third week of January, and a nurse coming back from Wuhan. New York City didn't announce that it had identified a case until March 1st, a healthcare worker coming back from Iran. So it's interesting that in both cases, mortality doesn't go up until after that federal declaration of 15 days, despite the virus having been identified in those two cities. We would expect not only in both cases to see a more gradual, or I would expect to see a more gradual rise, but I would also expect to see Chicago to rise first if the pathogen was there first. Comparing some other metro areas, we just selected a few here in different parts of the country. Again, didn't population adjust for on this one just because we wanted you to see the scale of New York City versus everybody else. Interestingly enough, Detroit, if you saw Detroit and New Orleans on the same graph, they were comparable in terms of magnitude and the nature of those events. But all of these metro areas, nothing's going on until that federal declaration is made. And for us, that raises some questions timing wise, especially when some place like New Orleans is in a very different part of the country, very different climate than Detroit. But still, New York is the leader, so to speak, in a bad way, by far and away. I'm going to transition to Jonathan for a bit here, but the only real place that we've been able to find in spring 2020 that outdoes or outdid New York is in some provinces in northern Italy, where we're told the virus hit sooner, a couple weeks before it hit New York City. So I have New York, Chicago, and Bergamo province here just to show you some comparisons. But I want Jonathan to talk about maybe kind of his interest in Bergamo and what he realized through his analysis of that data. But I do want you to realize that the Italy event actually took place a little bit before. I would say it was timed a little bit before the New York event.
Thanks, Jessica. Yeah, I'm going to just be relatively brief because Jessica's got a lot more to say about New York. I'm just going to take you through my thought processes, which led to me writing two pieces which were published on Panda's website and Substack about Italy, just to show you how my thought process developed, how I got there. So the first point that I noticed looking back at the UK regional data, this is actually all cause deaths across, obviously, you can see many different regions in the UK. And this is slightly misleading because this is actually monthly data, which is why all the peaks appear in the same place. But they are synchronized, they do appear in the same month. But obviously you can't say much more than that from this data. But it piqued my interest. I was thinking, wouldn't you expect some of the far-flung places, maybe their peak might be the following month or the previous month or whatever. So that was kind of where that started off my inquiry into is this really a spreading virus? Next slide, please. So this then is the NHS England data on daily hospital COVID deaths for 2020, and that, well, in 2021 going out to the right. But the point is, again, is this extreme synchronicity. We have we have 7 regions in the NHS England. NHS is our National Health Service, as you probably know, and you can see the data for the 7 regions there. And again, this is daily data. So the daily COVID deaths peaked on the same day across all 7 regions. That's interesting, and that's a little bit strange. Why it should be the same date? Okay, next slide. Okay, so from that, I came to the conclusion that to investigate this further, we need more fine-grained data to see if there is actually evidence of a spread of a pathogens. And there's a few sort of ground rules to this investigation. The first one is that we really need to focus on excess deaths and not really consider what might have been classified as a COVID death or not a COVID death, simply because the classification into COVID deaths seems to be different in different places, different in different regions, different in different times, and largely used as a, let's face it, it was used as a political tool. So I'm just decided from this point on, I'm going to just look really at excess deaths. And what we really need to determine if there is actually evidence of pathogenic spread is fine-grained, very fine-grained data, geographical data, to see whether there is any of the characteristic ripples and clustering that you would expect from the spread of a novel pathogen. And that took me to the some data that was available, which I'll talk about in a minute, from the Italian Statistics Authority. So unusually, the Italian Statistics Authority publishes daily deaths data. This is all cause death data by incredibly small geographical units, villages basically, and this allows us to do some more fine-grained analysis. But leading into this, first of all, just point out this is a similar situation to New York. We have here on the left, again, we have these incredibly high peaks in excess deaths, and they are all synchronized. Again, they're all synchronized across all the regions of the Lombardy area. And on the right, you can see that in we have excess deaths. I mean, you see there's the number of deaths occurring in, this is Bergamo actually, which is obviously the worst hit area. The the number of deaths occurring, it oscillates normally around a very predictable number. And you can see there with very little change in deaths. And then we have the bomb of which is on some days there was 1,000% excess deaths in Bergamo in spring 2020. Next slide. And in fact, one of the things that somebody in Panda pointed out to me was the only time in history where we have seen, certainly in Europe, we have seen outside of a war situation, where we have seen such a spike in excess deaths was actually in 2003 in France. And there happened to be a heat wave in France in 2003, and this you can see here. This sticks out, and is very obvious a spike in deaths, and this caused a national scandal in France. And the reason was because basically they determined that a lot of elderly people died from neglect. There's particularly people who were in apartment buildings in Paris. Their kids would clear off for more temperate places, the south of France, in the summer of 2003, and as a result, there were many deaths of elderly people, and it was determined that they died of neglect. They dehydrated, or they died of heat stroke, and it was a scandal. But notice here that the excess death rate is basically, it doesn't even reach 100%. And this was a scandal. The kind of excess deaths we saw in Bergamo were 1,000%. So you're dealing with something that is completely off the scale. Next slide, please. And when I started looking into Lombardy, and this, if you go to I noticed that Don has helpfully posted the link to the Panda papers that we wrote, and you can find a link to this paper, which is basically PCR testing in the region of Lombardy. And the key quote is there, is at the time of the first case notification, COVID-19 was already widespread in the entire Lombardy region. And actually, these case counts, the case growth had basically tailed off before any of the actual deaths were started to be reported. Also, a little bit weird. It's not what you'd expect from a spreading virus. Next slide. And again, here, this is just to reiterate, we have this regional synchronicity in northern Italy, a near simultaneous, non-spatially dependent process. And there's one region where it starts a little bit before the others, but every other is called Lodi, and all the other areas, this happens on or within just a few days of the 1st of March. That's where they basically all these curves take off. Next slide. So I've been trying to think of an analogy that people can keep in the back of their minds when they're trying to work out what the heck actually happened. And I came across this idea of a forest fire, so that if you came across a burnt out forest, if I was to ask you, just looking at the burnt out forest, I'm saying, well, was this caused by a firebomb exploding in the sky and taking out the whole forest in one go, or did somebody leave a barbecue lying around and it caught fire, and then the whole forest was basically consumed by fire? And if you the actual outcome of those two incidents, if you just look at it after the event, is it looks the same. You just have a completely burnt out forest. But if you look at the time series of what happened, you can actually work out whether it was a firebomb or whether it was the barbecue spreading from the corner of the forest. And of course, these analogies are, the firebomb, I am saying the firebomb is the imposition of a set of policies and ways of reacting to something on the whole of the region in one go, whereas the spreading barbecue analogy is more of something that comes from a point source and enters the area and then spreads across the area. Okay, next. And because of the fine-grained data that is available in from the Italian Statistics Authority, we were able to actually analyze to see if there was any pattern of spread. So what we did here was we color coded all the several hundred little areas in northern Italy with the numbers of deaths. Remember, this is all cause deaths, and compared them to the 5-year average. And you can see the color coding in the grid. But the point is that in February, it's all scattered. Some of the regions have less deaths, 0 to 50% of expected. Some of them have expected deaths, which is that kind of green color, and it's kind of, there's sort of no pattern. It's spread out. It's exactly what you'd expect. Some places a bit less, some places a bit more death than would be expected. And we've actually done. There's a statistic for measuring what's called autocorrelation, which we have actually run on this. I'm not showing this, but autocorrelation is a recognized statistic for how it represents how dependent a statistic is in one area to the area next to it, and it's a measure basically of spread. And we have determined that in this case there is no evidence of any spread, and I think you can tell that sort of common sense. There's no clustering at all there, which is what you'd expect if there was something going on. Next slide. So there on the left there, at first sight, this is in March when the virus is apparently hitting. At first sight, you might think to yourself, well, there's a bit of clustering there. But actually, on the right side, what we have done there is we have adjusted for the region, which region, the administrative location, effectively, of the individual area. And that takes out virtually all the semblance of spread. The point being that if the clustering disappears when you take the borders into account, it means that which one of a province a person lived in was a better predictor of death than whether there was a high rate of death from a neighboring municipality, which is completely counterintuitive to the notion of spread. It suggests, obviously, the point I'm making is it suggests that it's the administrative situation which resulted in more in whether or not you were likely to die, rather than whether or not the municipality next to you had a lot of deaths. Again, not really what you'd expect. Next slide. And in fact, here we are in May, and basically everything's back to normal again. This kind of rapid fall off, which Jessica's already mentioned in New York, is not what you'd expect. Going back to the forest fire analogy, the spreading forest fire, it would take, you would get, with a spreading forest fire, you'd come back a few days, or maybe even a week after the forest was ablaze, and you'd see little burning areas in different places, and maybe little tiny bits of new fire come up, and then it's sort of smoldering out over a period of time. Whereas this looks like something was just switched on and then switched off. Next slide. And in summary, which actually maybe in future, because I quite find this quite a compelling um, uh, picture that a chap called John De Gregorio put onto Twitter. I noticed this the other day. Maybe this just explains everything that I just explained in one graphic. Um, so it basically, you can see here that the top graph here is central and southern regions of Italy. No scary death spike. The middle panel is Italy, the north region of Italy, and obviously the bottom one is New York City. But the point is, how on earth can you have this scary death spike in northern Italy and in southern Italy? Absolutely nothing. Nothing going on whatsoever. And that again is not what you'd expect from a spreading virus. And that's really um, all I wanted to say about Italy. And I'm going to hand back to Jessica to continue talking about New York.
No, I mean, just to add on one thing there to make a connection back to New York, because of the timing, when you go back and you look at the timing of these events and you look at news reports, it's clear to me at least that Northern Italy, whatever happened there, was pretty formative in the way that Americans and people in Western Europe, especially healthcare workers, were thinking about the reports of this novel virus. I think it's fair to say that Americans at least weren't afraid of something because China or reportedly something in China was going on. Italy really, in a lot of ways, sealed the deal. Well, New York really sealed the deal, but it got people like, oh my gosh, Italy. We love Italians, and we do. We love Italians. We love Italian people. We love Italian food. The culture there. So for me, this played a really critical role in convincing people that something was going on. The sheer scale, magnitude, and speed of the New York City event, but also in Italy, by itself versus other locations, we think it really challenges significantly this idea that there was a spreading coronavirus that was the cause. We just don't see evidence of that. Next, we want to take a look at where people died. One thing that we don't have from the Italian data, at least we haven't been able to find it, is time series data on whether people died in the hospital, at home, in a care home, someplace else. In the United States, we do have that data for counties and cities. Sometimes you have to obtain it to get more fine-grained data from the city, which we've done for New York City. But I think looking at where people died is really important because it necessarily rules out what could and couldn't have occurred. So, for example, we have about 27,000 excess deaths that occurred in an 11-week period in New York City. People will say to me, well, it's the ventilators. It's like, well, right, but not all those deaths were in hospitals, right? So if you didn't die in a hospital, we can rule ventilator or that you died on a ventilator out right away. In CDC Wonder, that's the federal death database where all the death certificates go. When we look at 2019 versus 2020, we see some pretty alarming and I think counter narrative things just by looking at this alone. The first column, you see 2019 deaths, all causes, broken down by place. Every death certificate in the United States says not only the city that somebody died in, the date, the causes, but it says the type of place that they died in, and they're broken down into these categories. So in the first column, you see this is how many people died in that 12-week period in New York City. All causes: hospital inpatient, outpatient, nursing home, hospice facility, the person's personal home, dead on arrival to healthcare facility, or another kind of place like, Central Park or train tracks or, even a hotel, something along those lines. And then the second column, you see same period in 2020. And then I show just the raw number, increase or decrease, the percent change from 2019, and the percent of the total increase or decrease that place of death represents. So nursing homes as a place of death did see a very significant rise. In a lot of ways, we think that the deaths at nursing homes are the easiest to explain even without a novel pathogen. Um, Tons of neglect, I mean, cutting people off from family visiting, even sometimes the mere act of transferring people to different parts of a nursing home facility. There's a lot of ways, sadly, because there's a lot of people on the edge in a nursing home facility, that you could just leave people alone for a couple of days and kill a lot of people. So in some ways, the nursing home toll is the least surprising. That doesn't make it excusable. It's still criminal what happened, but it's the least surprising. Really, though, the most death occurred or is purported to have occurred in hospitals, inpatient and outpatient, and a shocking number of deaths in people's homes. Insofar as COVID deaths, it's also interesting to look at deaths by place of death in this period that attributed COVID-19 as the underlying cause. Overwhelmingly, the most COVID deaths occurred in the place of death that was incentivized to put COVID-19 on the death certificate, for people who are familiar with the CARES Act. Most over 80%, 83% of COVID deaths in New York City were in the hospitals. We do not have a breakdown of who died in hospitals. We don't know how many nursing home residents died in New York City hospitals. We still don't have that number. There were COVID deaths in nursing homes, but it's about 35% of the increase in nursing homes lists COVID as underlying cause. And then we have a pretty high number, I think, of people who are said to have died suddenly at home from COVID-19. So we're going to take a look at just a couple of these places of death in a second, but I want you to know that, and this is daily data obtained from the city. It's not from CDC Wonder, because Wonder doesn't have daily data. This is obtained from the city. But when I look at the time series data for where people died, it is pretty incredible, that synchronicity that we see all places of death, or all major places of death, go up at once. For me, that's unexpected. I would expect maybe to see nursing home deaths rise first, or maybe deaths in hospitals rise first. But we don't see any deaths rise until that federal proclamation of 15 days to slow the spread. And then notice that we see a shorter event, about 6-week event, for excess deaths in emergency outpatient, but just an incredible number of deaths occurring in hospitals. So we're going to look at home and hospital a little bit more in depth. I'll start with home simply because Stay Home, Save Lives, that was the messaging campaign that was launched also on March 16th. Andy Slavitt, one of the chief architects of this marketing campaign, and we were told, a lot of people in the world were told by their governments, to stay home because we needed to save the hospitals. We needed to save hospital capacity for those who really needed it. So what happened at home? Were people saved by staying at home? Well, no, we already saw the official toll is very high at home. So what happened? Well, the government has implied, through actually messaging even at the time and news reports at the time, as well as research studies, that the home death toll is largely attributed to people who should not have avoided health care, stayed away from hospitals and doctors, and died at home as a result. The other official story is that for New York in particular, if you go back and you look at news reports at the time, is that COVID-19 actually killed a lot more people at home who aren't included in the COVID-19 death toll for home deaths because they weren't testing everyone. And the Office of the Medical Examiner was overwhelmed. So overwhelmed, in fact, that the National Guard came in and removed 2,800 or so bodies from different places of death, which we haven't heard much about that in the aftermath of all this, but at the time, that is what was reported. And at first glance, I have to say that this was actually the story that I told for a long time, until I started looking at more data. Now, on its face, when you look at emergency department visits in New York City hospitals and you graph those alongside home deaths, it's shocking. It's shocking, and it does support that idea of, well, people were staying away from the hospital and they were afraid and they died at home. We see emergency departments visits plummet 60% as home deaths go up base to peak 400%. It's at the same time. So like, wow, people were listening to the government messaging and they were staying home and they died. The challenge I've realized as I've gathered more data with that idea is that in New York City, 911 call and ambulance dispatch data go up right with, again, that 15 days to slow the spread. People were calling. Ambulances were being dispatched. If you lived in New York City at the time and you said, I was hearing ambulances, I believe you because the data says that you were. But people were not being transported to the hospital. Transports were down, and the number of people being pronounced dead on the scene or even dead on arrival from the ambulance crew went way up. We don't have a full explanation of that. I've hypothesized some things, but there are some concerning orders that were given to EMS services at the time about keeping people away from the hospital, treating people in cardiac arrest differently during this event, putting masks on people. It's a really disturbing set of orders, but it's maybe not the whole story. But an increase of 180% over those 12 weeks is pretty staggering. And actually, home deaths stayed elevated for the rest of the year in New York City. And it wasn't just old people collapsing at home. We see increases of 170% plus across adult age groups. In those younger groups, the numbers are smaller, right? But they're always smaller. So the percent increase, the idea that 25-year-olds are dying at home in those initial weeks of the emergency event is pretty alarming. And as far as we can tell, New York City is an outlier in this regard. This didn't happen in Italy like this, as far as we can tell. So take a look from the dispatch data, and this is just public data from New York City open data. Anybody can, go into it and should, graph it, see what you can see. It's a huge data set. It's very complicated. But when you look at the dispatches, nothing much is going on with them. In fact, they were higher, I think, back in November or so. And then 15 days is called, and we see the calls and the dispatches go up, and then they come down. And they actually stay down for the rest of the year and into 2021. Some of this is probably due to telemedicine that was introduced, and so some calls are getting rerouted to telemedicine services. But when we know that home deaths stayed elevated for the rest of the year, I have some questions about, how good telemedicine actually was. So people were calling. People were calling for help, and help was being sent. The types of calls that people made did change. This is a table. It's actually a table that I made from data in a study put out by the fire department of some people from the fire department of New York and another medical center. Anybody can go look at the study, but what stands out to me, besides the overall rise in calls and maybe some things that we would expect given what government was saying, increases in cardiac events, increases in respiratory, but the increase in, even though the number is small as a percent of the whole, the sudden increase in cardiac arrest is pretty astounding. And in city data that we've looked at from other cities from around the world, it did not reach this level elsewhere. We also noticed that calls, psych and drug related calls went down during this period, which is a little counter expectation. I mean, even for me, it's like, oh, okay, they must have had tons of drug overdose deaths in this time. They actually did not. So we've wondered if some of these calls were actually classified as cardiac arrest calls. That's something just to think about. I don't know that for sure. So there was increase in calls, but this cardiac arrest is pretty alarming. We see that a decrease, as I mentioned earlier, in patients being transported. So they're going there, people are being declared dead. Could there have been some worried well? Yes, we have reasons from the data to believe that there were maybe some worried well calling who didn't really need to go to the hospital, right? Um, but that's not all. That's not all. This is emergency department visits, all dispatches, and transporting patients just all on one graph. Again, a pretty alarming picture is painted. Another dispatch code that we see went up and is very alarming is that, and this is actually the dispatch code that drove or comprises the biggest proportion of the dispatch rise, is refused medical aid. Now, normally, refused medical aid is when a patient refuses medical aid of some kind on site or refuses to be brought to the hospital for whatever reason. We have some reason to believe that RMA took on some more of a double entendre during this time, that maybe there's some really good anecdotes about this, but that EMS was encouraging people to not go to the hospital, which wouldn't be so alarming if about 20,000 of these calls weren't calls that were people who they were in a high state of severity. So the severity level of the codes was severity level 1 or 2 for about 20,000 of these RMA calls, which raises the question of why somebody would call, be in a severe state of distress, and then refuse medical aid. So this is something that needs a lot more in investigation. I'm going to skip this one. But the majority of the deaths that were occurring at home, or the pronounced dead dispatches, I should say, almost all of them, I think about 90%, if I'm not mistaken, were cardiac arrest calls. So this cardiac arrest event for us is unexplained. It's not explained by, we don't think, by the way that the Fire Department of New York has explained it in one of their studies as, COVID-19 and missed COVID-19 deaths and just healthcare avoidance and stress. Could there have been some of that? Yes. But that immediate rise really raises some questions about what the trigger for such an event would have been. And this is multiple data points that I've already showed on one graph. And we think it warrants explanation. It hasn't been explained so far. Incidentally, 40% of home deaths that were coded as COVID deaths in the United States in April 2020 were in New York City, even though New York City has less than 3% of the country's population. So again, that alone demands that authorities answer some tough questions 4 years later or so. This is for your reference. If you want to take a look at a study that FDNY and another school of medicine put out pretty soon after this cardiac event occurred, you should take a look at this one. This is my table of data from the study, but just an alarming number of people who were dead on arrival in that period, in that March-April period, or people that could not be resuscitated, even though attempts were made. Comparing this with Chicago, first of all, Chicago did not see a spike in 911 calls. I don't have that graph up here, but they did not. Actually, 911 calls went down in Chicago a little bit with the 15 days to slow the spread, and they did not see a heart-related deaths spike. They saw a rise, but not nearly to the extent that New York City did. Another alarming piece of data that we found through CDC Wonder is that there was a disturbing drop in autopsies conducted for deaths that occur at home. usually a medical examiner in any city or any state in the United States, they take jurisdiction, automatic jurisdiction over deaths that occur at home, especially if they're unexpected deaths. So we don't know why autopsies during this period not only didn't stay the same or go up, but went down. Really raises some questions about what happened with this home death event. The other place of death that we want to show you some things about is hospitals, right? Hospitals were the reason that we were told, or they were given as the reason that we should all stay home to save lives. And pretty early on in the event, we were besieged in the media by images and reports of apocalyptic events going on in New York City and at New York City hospitals. So what do we think happened in hospitals? What do we see? Right away, too, this is actually another piece of what I would consider timed propaganda, but it's amazing that 2 days after 15 Days to Slow the Spread was called, we see these simultaneously published op-eds in the New York Times, one from a doctor in Northern Italy and the other one from I think it's an ER doctor in Britain. The Italian doctor saying basically like, oh, we've just gone through this cataclysmic event, and then this doctor in Britain saying we're heading into the abyss. We're not prepared for this onslaught that's going to come. So really interesting sort of, I would call it, drive toward panic in these weeks when we look back at it. The official story regarding New York City hospitals is that hospitals were suddenly overrun by people rushing to emergency rooms with coronavirus-related illness. There was sudden illness, and they were rushing in, and hospitals were really overwhelmed, and they didn't have enough beds. In general, again, if you listen to Anthony Fauci and people like that talk, they'll say, well, there was a lot of early intubation. We didn't know what to do. It was learning that may be responsible for some deaths, but we've never really gotten some hard numbers on that, let alone numbers on how many total patients were intubated. There's also this sense when you go back and you read the stories is that there wasn't enough. There wasn't enough PPE. And because there wasn't enough PPE at this hospital, it contributed to the deaths of healthcare workers at that hospital, right? Just not enough oxygen tanks, or running out of oxygen is another theme in the news reports that you see at this time. And our pushback right now on that narrative or those explanations are that actually the data on hospital activity and capacity conflicts with that narrative of hospitals being overwhelmed. The inpatient death toll, the more that we've looked at it, it really defies credulity. The city claims, or the federal government claims, that almost 20,000 people died in 12 weeks, most of those in 6 weeks in New York City hospitals. There are 20,000 beds in New York City. They reported a peak occupancy of 20,000. So they're saying that they lost the equivalent of every occupied bed in 11 weeks. We just don't see that the common explanations that are given, or the sort of cliches that are given, are supported by the data. And I want to show you this by focusing in on one hospital, because to my knowledge, I'm the only person that's obtained this set of data on this hospital, but it's Elmhurst Hospital in Queens, New York, the so-called epicenter of the epicenter. Some of you might remember a video. I call her a damsel in distress, a doctor damsel in distress, Colleen Smith, that she made inside Elmhurst Hospital, and the New York Times published it on March 26, 2020. She's saying she doesn't have enough ventilators and people are coming in with COVID. But it's pretty fascinating to look at Elmhurst's data. Here we see emergency room visits. There was, and I'll show you even further back than this for context, but just from the beginning of 2020 to the end of 2020, we actually see that ED visits peaked before that New York Times study came out and before those videos were filmed. And just like we saw with the rest of the city, we have a major drop in people coming into the nursing homes. Um, forgot I left this in here because I tweeted this seriously. Like, this is kind of how I talk on Twitter, but like, seriously, really for the rest of the year? I mean, was this like the telemedicine initiative? Is that why people weren't coming into the hospital? But we don't see, we see a conflict between what we were being told and what this data anyway says was actually going on. I was able to obtain the same data going all the way back to 2007. And even if, there was a little bit of a spike there, I mean, very, very little, certainly not overwhelming, but in ED visits, we see that H1N1 was much, I call it the H1N1 panic, but ED visits were much higher during that time. They were also much higher in 2022, but we didn't hear anything about that on the news. Insofar as occupancy, this is data I obtained directly from the public hospital agency that runs Elmhurst and 10 other public hospitals. The occupancy data is counter narrative as well, and pretty disturbing. I got this all the way back to 2017, but on here I'm showing you the average versus what happened, or excuse me, the average 7-day average for 2018, 2019 compared to, or not, yeah, compared to the 7-day average for 2019, 2020. I find it really interesting that in early 2020, both non-ICU and ICU, the occupancy is lower. I don't know if that signals that a death event was happening sooner than we've been told. That's one thing that I've theorized about New York City as a whole, that there actually was excess death occurring and it got pushed forward on paper or in a computer into a spike. But this is not what we were led to believe was going on at Elmhurst or any place else. I also requested daily deaths from Elmhurst Hospital, actually for all the public hospitals, regardless of cause. And I did receive that data, but I had received it, or excuse me, I had requested it all the way back to 2017. And the agency denied me the data for 2017, 2018, and 2019. They said that it was in a separate system and that they couldn't access it because doing so would require them to create a new record. That is a bunch of baloney. A lawyer is needed to fight that. Maybe they know why I was asking for 2017, 2018, 2019. It's because the 2020 numbers are so unbelievable. Let's take a look. Elmhurst says that they usually experienced between 1 in 5 patient deaths a day. Then the emergency begins, and on that day that was reported in the New York Times, and they say 13 coronavirus deaths, their data shows 12 deaths from all causes, but that wasn't anywhere near the peak. They had multiple days. They had day after day after day in that period, or they report day after day after day of an incredible number of people dying, peaking at 31. But it's interesting because we didn't see another New York Times headline come out and say Elmhurst Hospital now has 31 people dying. So I find this, I have questions about this. I have questions about this when I look at all these dimensions for Elmhurst together in concert, and I say, okay, I say to myself, we don't have record level occupancy, really. We don't have an incredible number of people coming into the hospital, at least not through the emergency department, but we have a cataclysmic number of deaths. What was going on here? Is it possible that deaths were pulled from the past into the future and reclassified? Is it possible that they were pulled from later in 2020 back into the spring period? I don't know, but that's one possibility. And the agency not being willing to give me 2017, 2018, and 2019 for the deaths makes me even more suspicious. But for the city as a whole, if I look at, I mean, we see the same kind of claim being made. I just showed you with one hospital, the so-called epicenter of the epicenter, what's going on here. If these deaths are real, I don't know where the investigation is. I don't know where the documentary is. We need one. But for the city as a whole, we see the same thing. We see this massive spike in deaths in hospitals at a time when activity has plummeted. Moreover, the state, their data set for occupancy and ventilator use and all of that, it starts on March 26th, which is the day after the CARES Act was passed. And they have told me, the state has told me, the city has told me that they don't have earlier data because it's in a different system, or it was some kind of excuse like that. That's inexcusable because we need a baseline, and we don't have a baseline. This data could be pushed to the other side of the CARES Act for all we know. So the missing data is really alarming. One final thing I'll say about some terrible signals in the hospital event, or what's claimed, is that we have an incredible number of younger adults that died in New York City Hospital inpatient in these weeks, and almost all of that increase is blamed on COVID-19, which is widely recognized to not be, whatever you think it is, to not be a big problem or super deadly for younger people. So this alone, or some of these things that I pointed out alone, warrant some kind of investigation. And we just don't hear anything about this. All we hear, even from fellow anti-mandate people, even from health freedom advocates, people that Jonathan and I really like and respect, we can't get anybody to talk about this event or look at it again. Insofar as what we think happened, I think it's fair to say, without getting into too much detail, that we consider the event to be iatrogenic, if not worse than that. I consider the event to be staged. And we have some serious questions about the level of fraud that could be involved. And I don't mean COVID death versus non-COVID death, right? That is one kind of fraud, right? Saying that there's a new cause of death and blaming deaths on that new cause of death that should not be blamed on that cause of death. That is one kind of fraud, absolutely. But as a result of some of the analysis I've showed you and other things that we've looked at, we really have serious doubts that this daily death curve and its underlying curves represent a real-time, on-the-ground event. And we think that the burden of proof, we understand that we have some burdens on us because we're being so counter-narrative, but the burden of proof is really first on those who are making the claim. And so our key question is really, did the number of people who are purported to have died each day all die on that day? Die in the setting or place of death that is claimed, and died only once? That's what I want to know first and foremost, even before the how did people die, right? Did this number of people die? A claim has been made. Where is the proof? Numbers in databases and spreadsheets and reports are not proof of death or even proof that a death event occurred. These dashboards that were out early on, we all believed them or took them at face value, right? Because there was a shock and awe campaign going on against the populace, in my opinion. But can these be substantiated? These are representations of death records that are purported to exist. Where are those records? When we're thinking about proof of death, scientifically, in some ways, the only proof of death is a body, right? Or the remains, right? You see the person and they are no longer alive. We're obviously not going to get that, and that's not what we're necessarily asking for, although it is very disturbing that there are so many people who never saw their loved ones' remains, and they were separated from their loved ones during this time. So that those people would need proof, and maybe didn't get it even in the most basic of form. But death certificates would be one proxy really for the proof of death. Medical examiners register determinations like we have in Chicago. You can see every single death. They don't have that in New York. Even a basic list of names. whatever you believe about 9/11 and how that event went down, the buildings came down. We see the buildings being destroyed, and we have a list of names of those victims. We do not have anything of that kind for an event that was 10 times the casualties. I am working on getting data on burial and cremation records, insurance claims. Some people have said Medicare data. But New York laws, unlike other states or jurisdictions, do not permit the release or request even of death certificates under FOIA. In Illinois, I could do that. I could get every death certificate. I might have to pay a fee. but I could request it and obtain. I've obtained autopsies in my own county of people that I didn't know, or I've obtained them on behalf of other people. The medical examiner's determinations in my county and in my state are subject to public scrutiny, but they are not in New York. And that is a real problem and raises more questions about whether New York City was chosen for some pretty strategic reasons. A few months ago, I obtained some data. I was attempting a workaround, and I asked the medical examiner for the number of deaths processed by their office each day. And what I got back was shocking. I was not expecting it. In the data they sent me, spreadsheet that they sent me, they showed a processing event of 11,000 deaths in 3 days. Most of those from hospitals when I submitted additional requests and asked, like, where are those deaths from? I don't think that they process that number of bodies in their facilities on those days, but even as a computer event, even if it was a data transfer event, this event warrants explanation. This is a publicly funded office, but we've received nothing of the kind. And again, raises some serious questions. Even just the names. Jonathan Engler and I were on a podcast with Naomi Wolf last year, and we were telling her, like, look, there's no proof of this event. And she said something like, well, the New York Times, they published all those names. Well, they did. On May 24th, 2020, the New York Times published a feature in print and online, U.S. deaths near 100,000 and incalculable loss. No context, by the way, was given, no statistical context for what they were saying. But they printed 1,000 names, not 100,000, and I've gone through them. Somebody converted the list for me, and I've gone through them. 94 names are from New York City. So that's a pretty long way from the 27,000 excess deaths that are claimed to have occurred. A media outlet in New York City called The City did a project where they scoured obituaries for coronavirus victims. If my counting is correct, it's a little laborious. They wouldn't give me the database, but so I had to go through and count by hand. And I counted 1,620 names of New Yorkers who died during the spring 2020 event that they were able to chronicle. We're still a long way from 27,000. What about Hart Island? Some of you might remember the video and the pictures of Hart Island. There's a lot I could say about that. This is the city's island for public burials, unclaimed bodies, and so forth. The city does list, they have a, meaning the city of New York, they do have a public database that shows a registry of burials, and they have the person's name, their age, the death date, and their place of death. But even there's only 1,354 names. There is some crossover with this source. I haven't done a complete crosswalk, but there's overlap, right? If we did a Venn diagram. So at most, we're looking at 3,000 names, which is far, far short. Here's a graph of the daily number of deaths occurring in New York City in those 3 months, March, April, May. And then you can see the dates of death for those that are buried on Hart Island. So it's nowhere near the proportion that's needed. So again, we need proof. Why is that? I'm going to close out here. Like, why, who cares, right? Like, why does it matter 4 years later? Why should anybody be interested in this event? Well, think what we would say is that without the New York event, there would have been no selling Americans or even the rest of the world on the WHO pandemic declaration or the story of a novel spreading virus that was in need of new treatments and a dedicated shot. I think a lot of us, I hope a lot of us could agree that there were many, many people around the world that were coerced into getting a shot or got it based on fear for one kind of another, fear of the virus, fear of not being able to do something, fear of losing a job. This event was used to prove to people, so to speak, that something was going on. The government has every incentive to lie about not only the causes of death in New York in these months, but also the timing and the magnitude and the places of those deaths. They need to prove that it occurred. If the curve is manipulated or fraudulent in any way, I would say it presents a serious challenge to the WHO pandemic declaration. And if New York's curve is manipulated, then that means we're looking at a US curve that's manipulated as well, necessarily, because New York was such an outsized proportion of deaths in that spring and everything else that followed. So we need proof that America's largest city experienced such an extreme, sudden loss of life. If for no other reason, just be, for the sake of the victims, both that died and maybe the people who are claimed to have died and did not. I think we can take questions now. I'll go back to that if we need to, but I think we can take questions. Don, if you want to put some out there for the chat, or Jonathan, what would you like to add? I talked for a long time there. I know I was lead on this, but anything that you want to add on, Jonathan?
Uh, Nothing. Just to remind people this idea that we had this test, and we've determined COVID deaths from this test, which is the PCR test with all its
Mhm.
faults, etc. And we know that by that test, if we go back in time to before these excess death curves, claimed excess death curves, perhaps there were definitely excess deaths, but we don't know the extent. But before the deaths started to rise, we know that there was a significant presence of that signal
Mhm.
for weeks or months, maybe 6 months, maybe it doesn't matter how far back you go, but but for a substantial period of time before the death started. And the question that nobody is able to answer is how can that signal be present for so long before the death started without causing any excess death or reports of any clusters of unusual illness.
Sure.
Um, and obviously, this generates the quite, the simplest explanation is that the excess deaths and the reports and clusters of unusual illness were caused by the declaration of the novel deadly pathogen spreading.
Mhm.
That's that's the theory in a nutshell.
I have
There are a couple of questions
yeah, I had a
asked.
question that I wanted to dive into before you go there, Jonathan. Before we dive into the audience questions, I'm going to put it on the screen. It needs a visual aid. Um, the question is really about the sort of standard disease, curve, or what we think about as the standard disease curve. And um, you have this sort of, it's usually there's an incubation period followed by what people call a prodromal period, or, the place when the symptoms are starting to show up. And then it sort of ramps up and usually, I mean, it's represented as a kind of reverse, as a bell curve, right? So it's rising and then it tails off as symptoms decline. And eventually you have convalescence and recovery. Um, that's sort of the prototypical stages of disease. And then I think throughout that the pandemic or whatever we want to call it, people were encouraged to think about epic curves, right? And the whole notion of flattening the curve was a huge part of the discussion. And you start to wonder where is that epic curve in that New York data? It's markedly different, and I guess I think that that's part of the context that strikes me when I saw your work. It's how did that data show up like that? It doesn't match anything of what we would um, think of in terms of, oh, finally it's starting to show. Hold on. So this is the picture that I wanted to share. Um,
Oh, right. Yeah.
and this is sort of a from a textbook almost sort of view of disease, where there's a ramp up and then there's a tail off. And I guess we would expect the data to look kind of like this sort of epic curve, which we were encouraged to look at all the time, right? Where
Yeah, although your previous slide is actually, it's meant to be the number of virions or whatever in causing it's an in that is a
right,
is supposed to be in an individual patient,
correct,
whereas the next slide is obviously the number of cases but
correct,
the point is that that I think you're making is that that in if it was a spreading respiratory pathogen, there's a huge amount of variability in these time frames of how people are ill, etc.,
right.
etc. And you would not expect a near simultaneous increase and then near simultaneous fall off, and or it to be synchronized across all these different regions as well, as I showed you in the UK or in Italy.
That's right.
It just wouldn't happen.
Right.
Or
So
you
we would
wouldn't.
you'd expect to see some sort of growth period and then a decline
Yeah,
period, and how
yeah,
all those curves stack up for all the different individuals who are infected would make up a larger curve that we could see, right?
correct. Not an
Well, and
event like this.
I've joked that, oh, this was such a polite virus. It was so patient, that it waited until governments
Mhm,
said something to show
mhm,
up or do anything. And that's one reason why I've looked at different kinds of data,
mhm.
right? So not just um, cases or even not just all cause mortality, which I'm a fan of looking at, but like the 911 calls and just any or just different. I didn't show it in this presentation, but just okay flu data, like any, where is the smoke signal? Where is the smoke signal? And you do not see it. What you see is something that looks like what I've called a Faucian fantasy. It's almost like somebody took 1918, whatever happened there, right? And that's even under dispute. There's different theories about that, but it's like somebody took that and then used it as a model, right? And then, filled it, filled in the model, right? It looks like an engineered event, like what a bunch of, pardon my phrase here, but what a bunch of tech bros in Silicon Valley think that an event would look like. But in reality, it just defies credulity. It's just an impossible event. So that's one reason why we've landed on like, hey, they need to provide some basic proof that this death event occurred. Some basic proof, and that hasn't been done.
Yeah, that's the that uh, data that you showed of something like 6,000 some odd deaths being handled in one day by the medical examiner is pretty striking. Uh, what is that, a quarter or a fifth of the total deaths all in one day?
Yeah. I mean, again, even
Is that
in
a
and
data entry problem or
yeah,
is that
well,
what
yeah,
is that?
and tech people have said when I posted it on Substack, I think I have some commenters in there who are like, hi, chiming in here, like I'm a tech person. Like I don't even understand how that would have been handled technologically. We know that the military descended on New York City in
Mhm,
multiple ways. That would be a whole other presentation.
mhm,
But when you think about who can handle those bodies in that time, or who could, if they're legitimate, or who could even handle that processing event.
right.
Well, military might be
Yeah.
able to. So
I mean,
I have
it
some
almost
questions.
seems like and this is of course complete speculation, but it almost seems like a database ad, at
Yep,
just in one day,
like a
here's an
transfer.
infusion of numbers, but actual physical uh, processing of bodies, that seems like that's like war zone level kind of.
Oh yeah.
Well,
Yeah.
talking of processing of numbers, I think I mentioned to you before we came on that we're soon in Panda going to be publishing in the next week or two an article on digging into the John Hopkins University dashboard, um, because it looks like most of the numbers in that dashboard are actually modeled, and then we wonder how many other cities and states took their data from that and made it match. Um,
Mhm.
and the reason why we think it's actually common sense tells you that it's modeled because basically, I mean, the U.S. government says it takes it 2 years to compile flu stats. and that's just in its own country.
Mhm.
So suddenly we are meant to believe that a university can establish a dashboard, which it said it established in February, before there were any deaths outside of China, actually. Um, is meant to have established a dashboard which can report on real-time COVID deaths from 100 and whatever it was, 60 countries
Mhm.
in real time. I mean, this is just completely nonsensical that they could even do this. So therefore, there had to be modeling involved.
Mhm.
And the question is, what were the inputs onto those models?
Yeah.
And my guess is that the inputs had something to do with a traditional SIR curve, which is why the death counts look like SIR curves.
Right.
Um, there were a couple of questions that came in the chat.
Yeah.
Should
I
we
think
just address?
sure.
But
One of them I think is about Italy. You had a very interesting slide in the presentation that showed, the sort of seeming um, clustering around uh, Bergamo, that area, and it looked like a hot spot. And then you applied a filter, and then the pattern goes away. And just in the process of explaining that, I was wondering if you could go into more detail because I think it's an important slide, and it blew by me at the moment when you were going through it.
I can go
yeah,
back.
so I've actually pasted in the text from the article into the chat. I mean,
Yeah,
I would encourage you to go to the article. So basically, we took it's a two-component model
yeah, this one.
with the
Hmm.
uh, administrative province in which the municipality is located, and then the death rates. And you can see there that the left-hand one, we just look purely at death rates. And then in the right hand one, we actually effectively adjust for administrative province. So you can see that the administrative province is the dominant factor in terms of, because when you adjust for it, there's basically no clustering.
Mhm.
So does that mean that if, taking it from a layperson's perspective, does that mean that a certain administrative area was applying policies differently from the rest of Northern Italy?
Yeah, it means that the dominant factor in how many people died in a municipality is which administrative region they were situated in, not what the municipality next door looked like in terms of the number of deaths.
Hmm. Hmm.
So it becomes a non-factor. So it
Yeah.
is basic, yeah, which suggests that it is a policy-related difference, not a viral spread-related difference.
Yeah, this is almost a sort of graphic example of how data representation can change your interpretation very easily, just
Yeah.
through a little graphic shift.
Mhm. Yeah.
Um, Diana had a question that is interesting. She says, Dennis Rancourt argues that COVID doesn't behave like a respiratory virus because death rates seem to be different in different localities, and the difference occurs sharply at the end of the county or state. And is this corroborating with your study? I guess, like New York and New Jersey and uh, even Virginia or DC, like how did the spread map out with nearby um, counties and
Well, I mean, his analysis is similar to ours in the sense that he says there's no evidence of spread, although Denis hasn't. I say Denis because he's French Canadian, and that's
yeah.
how he says his name, Denis Rancourt. Um, he does not question, or hasn't really yet questioned, the excess death numbers. So but he has looked at the spread. I don't actually understand, Diana. Maybe you can explain what you mean by the difference occurs sharply at the end of the country or the state.
I think she says county, so it's sort of the idea that big case numbers stop at seem to
No,
respect political
country,
boundaries.
Right, right.
country, country, like you were saying, North Italy versus
Oh,
South Italy. That Denny Rancourt reports similar abrupt changes when you come to
yeah.
boundaries of,
No, absolutely.
Yeah.
So I
Political
mean, you see
boundaries.
it all the time. For example, the one of the best examples of that is the Canadian cities, which are their large Canadian cities are obviously very near the US border. We have, you know, reports of deaths, significant excess mortality across the northern states of the US, but then just over the border in Canada is nothing happening. So there must be that is not
Mhm.
uh, that's not what you'd expect from a pathogen. And the same in Germany. The countries around Germany reported significant excess deaths, but Germany itself in 2020, nothing happened.
Mhm.
And obviously, our theory is that I mean, there have been various ways of sort of terming this. The phrase I like, which was come up with in somebody in Panda, is the healthcare fragility hypothesis, which is that it's the amount of disruption to healthcare in these different places that determines how many people actually died. And if you take Germany, for example, it actually has very high capacity, and people, and they have they don't panic about things. They have a very decentralized health system as well. So every decision making is taken at a very local level, and so maybe it's harder to impose sort of top down policies in Germany, and they had no excess death basically. Um, and I'm sure there are if you think about all the differences in the cultural differences, political differences, social differences, the organization of nursing homes and care homes, um, these this is it's a complex ecosystem, and those changes are surely what you need to look for differences in the number of people who are reported to have died in these different places, because the virus is supposed to be the only constant. So why should it be a different behavior in this virus that's supposed to be the same constant, rather than the things that we know vary between all these places, which is more likely to explain the different outcomes? And I talk obviously very carefully when I use the word outcomes, because I wouldn't want you to think that I'm suggesting that there was a virus that swept across, directly causing these deaths. Whereas obviously our theory is that it's the response. In most places, it's the response to the notion that there was a novel pathogen which has caused the harm. Although that New York and northern Italy, we think are a special case in that we actually doubt the numbers reported.
Yeah, I mean, I can you see what I have? Is my screen showing? I
Yeah.
don't know.
Mhm.
Showing. I mean, it's absolutely ridiculous. For the idea that a virus attacked New York City in a way that it attacked no place else. It's insulting. It had 20,000 deaths that attributed COVID-19 as underlying cause happened in New York City. That's 20% of all COVID deaths that were reported or almost 20% in the period. No, it's over 20%. And then you figure in, so if you do look at counties, which I actually have done a bit, and you map it and you look at a map of it, it didn't take much that spring to get to that 100,000 deaths number, right? That the New York Times emblazoned on its front page. And
Mhm.
they never said 50 to 60,000 people in the United States die every week from all kinds of causes. There was no context, but you do not need everybody on board. You only need a few areas. You need New York. You need some excess in LA, even though they didn't have much. LA is a 10 million person county, right? So you don't even need that much from LA to get to that 100,000. You need Chicago, Philly, they did New Orleans. I have some theories about that. But why did New Orleans, the speed of New Orleans death rise is almost as fast as New York.
Mhm.
And they all happen at the same time. That's not what a pathogen does. That's not what a spreading pathogen does. And that's something else I like to keep in mind, that the impression that we were given, I don't think there's any proof of this actually, is that something was spreading from person to person. Something was spreading, just like in the movie Contagion, just like an outbreak, right? But that claim was never proven. And we didn't have a pattern of clinical presentation coming before, or doctors observing something before the advent of mass testing. And we know actually from a couple studies that came out right away in New York City, we know that these hospital systems, they tested everybody who was already in the hospital. They tested everybody who was already in there. So I want data on what percentage of those hospital inpatient deaths were admitted to the hospital before March 15th. Are we looking at a death toll that includes people who were admitted in January?
Mm,
That
yeah.
that's what, so these are basics. This is basic data that we should be given by the federal government because they claim that this massive event occurred. There's no 4-year documentary about it. There's no memorial planned. Manhattan elites aren't calling for a fundraiser,
Hmm.
right? That the silence and what's not being said is a tell, in my opinion.
And we have presented this in various forms to quite a few people now, and a lot of people are. We've sent it. We've sent a very brief description to people, and there is a wall of silence. There is an
Mm,
omerta on examining what happened in New York in spring 2020. It's like it's a done deal. We know New York got hit
hmm.
hard by the virus, and nobody wants to really go there.
It's
You
like
know,
people signed NDAs. That's I'm not saying they did, but that's what it feels like. Or it's
mm,
like the I don't know if you're any Harry Potter fans
like a
out there.
forbidden
The
topic or
thing that
something.
will not be named, yes, no
Yeah.
matter, or there's a national security shroud around it that people have tacitly agreed, or in the beginning had, tacitly agreed to not talk about it.
Hmm.
Um, or
You
they've
know,
been rewarded in some ways. I don't know. I'm speculating, but that's kind of
sure.
what we're left to do when nobody will talk to us about it.
You know what's interesting is I think cognitively people like to gravitate towards kind of either or questions, or here's an answer, that one's proven wrong, then this other one must be it and it must account for everything. Um,
Well, I think they also like villains in the story.
sure,
Sure,
this is these
sure.
these sort of
Yeah.
dipoles, right? A
So
dichotomy is
it
like you're
Almost
the
false.
it's
yeah,
Almost
very
false.
to say it was yeah, Ralph Barrick and
sure. But it
etc.
could also
etc.
be, things that are somewhat easy to believe, like, oh, all the deaths were caused by remdesivir, or all the deaths were caused by ventilators, or all the deaths are, it's in a death certificate coding error, or there's sort of lots of ways that you can think about it and try to identify this mechanism by which, all these numbers could conceivably come out. The data doesn't actually seem to support any one of those on their own, though, which is interesting. And I think one of the key bits that you identified, Jessica, is the cardiac arrest piece. We were told SARS stands for respiratory syndrome, does it not? And if people are dying from SARS, uh, why are they all being dying from heart attacks?
And of
Yeah,
course,
I mean,
According to the
actually,
data, or a huge
the
number.
heart, yeah, the transmogrification of that's a word of the virus from a respiratory one into a cardiac one was supposed to happen in 2021.
but actually, if you go back, and I'll say anybody can look it up. I think it's Peter McCullough in the Wall Street Journal in April 2020, and others saying, COVID is a vascular disease. A theory is that I'm not saying Peter McCullough knew this, but that the New York City cardiac arrest deaths are a reason that that narrative was born. They need an explanation. Also, I don't know if it was clear, I didn't really point it out, but all hospital, the hospital inpatient excess, which is almost 15,000, or, between 14, 15,000, it, it's all explained by COVID. So in other words, hospitals are saying that they didn't have any excess death in the period that wasn't something called COVID-19. Well, now I have questions about what COVID-19 means. Capital COVID. That it's an acronym. I have questions about whether there's another meaning of it, or a backstage meaning that provides plausible deniability in the future. Or New York, something I didn't mention is that New York City on April 14th announced the addition of 3,700 probable COVID deaths. And then they kept adding to the toll. And they said that some of them were from home, some of them were, we're not getting, there's an undercount, right? When were those deaths from? Were they, hey, December 2019, that was probably COVID, right? And then they reclassified it as a probable COVID death and stuck it into that spike. Is that possible? Do we have fraudulent, completely fabricated death certificates in there? I'm not saying that's the most likely explanation, but it's one of many reasons why we need proof of the
Yeah,
event.
questions, questions, questions. Diana, do you want to ask your question?
It's a follow-up to the discussion we just had, because I have this kind of exhaustive, what are all the different factors? And I do have something in the chat. And I think what's occurring to me is that there were deaths that didn't occur for the reason that we thought. And, there's the idea that some of these deaths did occur, but were not necessarily COVID, but remdesivir, or really it was something else. And there's that. But we just were discussing that it's unlikely that all of it could be that. And then see if I'm wrong here. It seems that there is an elevation of the death rates and also mistreatment, which could elevate the death rates. Besides remdesivir, there's people being withheld fluids. They're not allowed to eat or drink. But then there also may be this data. I am wondering, how does the death get into the system? It seems you change the cause of death on the death certificates, okay, but now it seems like there's another source of inflation. Am I wrong that you're making this argument that things were vastly inflated because of the data, not just because the deaths occurred, but they were misclassified?
Yeah, so I mean, after studying this for a while, I've come to there are and were multiple factors. People unilateral DNRs. Like I've documented, there's a lot of factors that we could use to explain. But even with all those, the magnitude and the speed of the event, and then when I look at what's being claimed about the number of bodies in hospitals and the cardiac arrests at home, I'm like, okay, I first want to know, are we looking at a curve that's representing a real-time event? Did at peak 1,200 people die on April 9th? I can't remember the peak, but and did this many people die the next day? Did this many people die the next day? That's my concern. And maybe where we differ from Denis Rancourt, whose work we really respect, and he certainly called the no pandemic thing right, put his theories out there right away in June 2020. But we're more zoomed in on cities. We think cities and the smaller geographical units are key to the analysis. And then and I understand why he does, but he puts a lot of faith in these government statistics for all-cause mortality. He considers them, and I understand why he does, because I did too. He considers them very stable and hasn't considered that all-cause mortality could be manipulated. I think it could be manipulated around the world. I don't think it's just New York. And all you would have to do is some of the cities in the places, and pull, maybe deaths were held back. Maybe it was a severe flu shot season, I call it,
Yeah, I
right?
mean,
And
it
so
is
that
important.
I'm just saying some ways that it's not that we conflict with Denis, it's just we're looking at a different level of analysis. And anyway, I won't speak for Jonathan, I challenge the notion that we can trust the all-cause numbers, because these people have lied about everything. Not Denis, the government has lied about everything in this mess.
Yeah, I think it's important to realize that it is a complex sort of patchwork of different things happening in different places, and certain high profile places, different things seem to happen, like New York. But if you actually look at national level data, for example, the UK, we reported in the UK, we reported the scary curves. But the scary curves in the UK are not all cause mortality curves. They are COVID death numbers, and this is where your attribution point comes in. They're COVID death numbers, and actually, the total crude adjusted mortality numbers in the UK, 2020 was actually the only the 8th worst in the 20 years since of the 21st century. And that is the same across many countries in Europe. This is a bit of an unremarkable year in total mortality terms. And in fact, if you look at global estimates of mortality, there's nothing to see. There's literally nothing to see at all. There's no blip in total death, total mortality across the world as reported in 2020. And in fact, in one of my early Substacks, you can see that an article that's been written in which they've looked at total mortality across the whole world. And this is a very strange, lethal, deadly pandemic. Incidentally, again, in that Substack, and in fact, I'm going to just put a link to it in the chat here, but in that Substack, I do cite an article which was published in Medium in May 2020 by a guy called John Pospical. Yeah, yeah, and so he can probably credit himself, although obviously I put it.
We haven't been able to find him. He's MIA.
You can't find him, so he totally disappeared after that point. But he in early May 2020, he published his article in Medium called "Questions for Lockdown Apologists," in which he said he just noticed that there was no excess death anywhere before any of the lockdowns. And so why does the excess death start everywhere after the lockdowns? And this is a question that still hasn't really been answered. I mean, according to the pandemicists' theory, it would have been a lot worse, had they not locked down, and the virus spread silently and then went off as soon. But it's so curious that it goes off at exactly the same time in relation to lockdowns and restrictions everywhere you look, which obviously raises the question as to what the cause of all the reported deaths were.
Fascinating,
I thought there were
fascinating.
some statistics to show that that the lockdowns overall in different areas were not related to the infection rate or the death rate. But in some cases, like in island nations like New Zealand and Australia at first, it is possible to quarantine people pretty successfully, but eventually they get infected.
But this is that theory is that there was something novel that started at that time, whereas our contention is that there was nothing novel that started at that time other than the testing. Now, if you imagine that at a high level, my explanation for the observation in Australia in 2020, where they kept it out, is that they simply thought they'd kept it out. If you imagine that this whole cycle of hysteria about case finding and about you're going to be overwhelmed and therefore you disrupt all your medical services as a consequence, and you stop treating elderly people, you stop visiting elderly people and everything. If you actually think you've kept it out and that you're safe, then in your sort of psychological fortress inside, you carry on life largely as normal. And that's, I think, is what actually happened in Australia in 2020. I think they just thought they were invincible and they carried on life as normal.
The other perspective on that, which I have a darker perspective on that, and I know Jonathan Cooey has said this as well, because I think things were more planned and more staged. And I think New Zealand and Australians all-cause mortality for 2020 could be fraudulent as well. But the island nations and states, Hawaii, I think were used as example because they're islands. They were used as examples of, look, you can keep the virus out. Right? So it's like, New York was used as look, it gets hit hard, but then we learn to handle it and then it goes away. Right. And it's interesting in New York's pandemic planning, there's an interesting document that the Office of Medical Examiner put out in 2008, and their lower bound projection for a pandemic flu was 27,000. It was 27,000, and they said that there would be one wave. And that's what we see. So, I mean, these things are just hard to ignore. They're just hard to ignore in retrospect. I don't know that any of us were seeing all of this in real time. We could not have, but doing an autopsy, the missing New York City autopsies, doing an autopsy kind of brings new insights and questions to my mind.
Well, you
But
were,
by the way, uh, I was going to say, by the way, Jessica had mentioned, Jonathan Cooey there, and I think it is definitely worthwhile watching some of his videos because he goes into some of the virology of the situation and explaining why it seems to be highly unlikely that an RNA virus has the replication fidelity to have escaped from one place and then spread across the world, causing a
ah,
similar disease. So
Right.
it's worth checking that out.
Yeah. We had a brief touch on that with Geert van den Bosch when he was on.
Oh yeah.
Um, one thing I wanted to ask you folks was the very early on, it seemed very obvious that coronavirus was not deadly in the way that it was characterized. I mean, you could look, I guess, the Diamond Princess, and some people have
Mhm.
questions about that episode, but clearly the infection fatality rate is not, what it was claimed to be. Um, and the Ioannidis papers bore that out. Um, there's also evidence that the uh, signal from the virus was being detected much earlier than 2019, possibly 2018 or even earlier. So you have this potential for uh, the signal to already be present in many, many populations around the world, maybe all all over the world. We have no way of knowing for sure. And we also have this PCR test, which or versions of the test, which I don't think very many people were able to test and verify to confirm what were the primers being used, and you know, um, are the primers nested? What are they actually screening? They didn't have a control, a negative control, as Dr. Jack loves to point out, and all of which are very important. And so you have this potential for obviously using a bad basis for a test to confirm a lot of statistics that say there is
Mhm.
something awful out there, but then you have this moment where you go from, okay, I've detected this signal, but does that mean that that's what killed these people?
Right.
Right.
Absolutely.
And
Right.
that's a huge jump. Um,
Yeah.
and that's not
I-
necessarily to say that the spike protein doesn't exist, or that this signal doesn't exist, or that people aren't actually observing in their clinical care or in their lab work or study work that they're seeing some things, but that doesn't mean that the narrative is true. You
Right.
see where I'm
Can I just
going?
say a few things about
Yeah.
what you just said then? So it's interesting. So Ioannidis, if you think about his calculation, so he will have dramatically. Um, he comes up with saying that in young people or people, I think he said something like below 70 or something. I think he said the
Yeah.
the infection fatality rate is in the ballpark of seasonal flu, is what he said.
Hmm.
So, but bear in mind that he will have overestimated the number of COVID deaths because these are taken from official government statistics.
Yeah.
So he will
Yeah.
have he will have the people who fell off a ladder and died of a head injury who had
Yeah.
tested positive 2 weeks before, the car accident where they tested
Yeah.
positive. All of those went into the COVID deaths. So he'll have dramatically overestimated the COVID deaths.
Yeah.
And as for remember his exposure comes from serology.
Hmm.
And that serology will also underestimate the number of people exposed because a lot of people fight this off mucosal barrier and there's no seroconversion at all. So
Yeah.
all of this is based on a completely inappropriate traditional model. But even with those factors, he said that it was in the
Yeah.
ballpark of seasonal flu. Um, And so the question that New Yorkers should say, well, so if it's in the ballpark of seasonal flu, what the heck happened in spring 2020 in New
Right.
York? How can something that is that innocuous cause those
And
claimed death
9/11s
curve?
and 9/11s.
Yeah,
That's what it
9/11.
did.
Mhm.
Yeah.
By the way, there's an article on the Panda website about Diamond Princess, which people might want to see if they want. And let's not forget, tying all some of these themes together, um, the Diamond Princess. Actually, there was no the number of people who died apparently from COVID and the Diamond Princess was no greater than the actuarial expectations,
Right.
given the age range of the passengers on that cruise ship. And also bear in mind that in the weeks following the event, the US ambassador to Japan published a video on Twitter
Mhm.
in which he thanked Gilead for compassionate use provision of remdesivir
Mhm.
for the patients who came off the Diamond Princess
Mhm.
with COVID.
Mhm.
So
And
that
some of
raises
the
some
patients
interesting
who
questions.
died were on ventilators as well. So
Yeah,
I mean, well, even those deaths, even though, like Jonathan said, they're within actuarial expectations of how many people you could expect to die within a month or two after any cruise where you have a lot of, elderly people going on their last cruise, right? But
Mhm.
but even then, we don't know enough about the treatment of those that died to be able to divorce the rate from iatrogenic measures that were taken.
Mhm.
and the other point I made, which to pick up on where you talked about cause of death and on this ridiculous test, um, is that before 2020, um, the general attitude towards attribution of respiratory infections to an individual pathogen was we can't really tell.
Mhm.
And the reason we can't really tell is for two reasons. One is that if you look for them, you find multiple pathogens all the time in people. And to say that you detect one, that's definitely the cause of that illness, it was before 2020, people would have laughed, people in the
Mhm.
field. The second point is that before 2020, um, it was generally assumed that nasal and throat swabs, what was found on those swabs physically bore no relation to what's going on in the lungs. And
Mhm.
so suddenly these two truths that were known in up till 2020 are suddenly obliterated. Apparently,
Mm.
this virus on its own is the sole cause of deaths, whereas before it was multiple pathogens, and we can detect it in the nose and be sure that that's causing an illness in the lungs. These, on its own, that this inconsistency basically destroys the novel deadly virus pandemic narrative
Yeah, I
because
mean,
we've no idea what was causing people to be ill.
yeah, I mean this goes back to what we actually know about the world that surrounds us. I think people like to think that we, I don't know, have sequenced everything and therefore we understand everything. But the truth is we know a very, very tiny fraction of what's out there. Just like they say, oh, we understand, what is it, 10% of the ocean. Even
Probably
though
not
it's
even that.
it's it's probably not even that. It's been around for, forever, longer than us.
So
But
I put a link into the chat to a piece which has got a link in it to two studies called the EPIC studies,
yeah.
Mhm.
which were CDC sponsored studies from 2015. One is in adults and one is in children,
Hmm.
which go through this whole notion of multiple pathogens and so on.
Like the human papillomavirus, for example. People like to think that there's just a handful of these clades around, and they say, oh, so the Gardasil vaccine has nine. Um, it's a non-valent vaccine, but in reality, there's more than 300 that they've actually sequenced, and there's probably even thousands more that we have no idea about. There's so much out there that has not been identified and um, into the of a level of a species, or if species is even the right word for it, but we don't really know what's out there. And so to say that I've because I detect a small piece of something, that I know that this caused this thing, is really kind of a crazy elaborate fiction.
Right. Right. And as I said earlier, you don't have these stories of doctors saying that they had, and actually I've asked a couple doctors, was it a more severe flu season for you?
Mm,
Were you seeing certain things, before the naming and testing of this newly detected agent,
mhm,
I'll call it. And we just we don't hear that. Clinical presentation did not precede the naming and launching of this.
mhm,
Which is surprising because if you think that medical publishing, this is often the lifeblood of academia is publishing, and you'd have thought that somebody would have said, "Ah, we've got a cluster of really unusual, a really unusual respiratory illness there," because it was said to be a really unusual respiratory illness.
mhm.
But in fact, I know, everything was COVID, and COVID was everything in
Yeah,
2020.
yeah.
Right.
Even it was every symptom could cause COVID,
Mhm.
and then actually not having any symptoms was also a symptom of COVID.
Right,
Right. And
right.
it
I
was
mean,
nowhere. One of our colleagues in Panda, Todd Kenyon, says it was nowhere, and then suddenly it was everywhere. Right.
Right.
And nobody can explain what the trigger was. I mean, I've heard people say there's a seasonal trigger. What was that? Like,
Yeah.
how does that magic work? Almost like the virus met some kind of critical mass.
Mhm.
Well, like it was out there and then all of a sudden, but no one can explain why that happens in New Orleans, right? But not really that much in Seattle, funny enough. Seattle didn't have a lot of excess death in, even though
Even though
they
they
announced,
had one of
hey,
the first cases though,
they had
right?
buffers. Yeah, the
Yeah,
snow, I call him the Snohomish man. Yeah,
right.
Snohomish
So how
County.
come
So,
what's going on with that? You know what's
yeah,
fascinating is if you start to go in, you could go into a sort of a Sherlock Holmes mode and say, which came first? Was it the dashboard or the pandemic?
yeah.
And
yeah.
it if you approach it from the side that here's the graph or the data charts that were used to scare people, and you work backwards and you say, oh, I need to have data or I need to have something that supports the reality of that dashboard after the fact. In the moment, a dashboard or a graphic, like you showed even with that Lombardi graph, you can represent anything you want with colors and intensity of dots or curves. And the basis for that data can be real or it could be fictitious or it could be a conflation of both. And so it makes you wonder, what came first? Did the dashboard come and had to have evidence to support it, or was there evidence that actually supported the dashboard? It's all just a
Somebody,
big
somebody
question
in
of,
the chat, Diana asked about 5G. I get that
hmm,
question a lot
yeah,
lately. I don't know a lot about 5G or, radiation or some of these other things. Um, for me, it would still be a timing issue,
mhm,
right? I haven't had anybody come to me on Substack and presentations, Twitter, and look at the data that I'm showing about timing in New York, including potential fraud, and explain it to me in terms of 5G. Right. So I don't always know what people are contending happened. Or people say, well, something was released in the subways. Like, okay, walk me through when,
mhm,
how, which subway lines. It's not that I don't think I'll basically everything's on the table when it comes to New York, except that a coronavirus killed 27,000 people. But I think a lot of people have put possibilities out there, but haven't contended with the
mhm,
timeline and with the data. And so, do I think 5G could be harmful? Yeah, I don't dispute that, but the idea that that caused the spikes, unless you're saying that 5G related deaths are taken from another period and put into the spike, like I've talked about before, then I'm not really fully apprehending how people are using 5G to explain a Bergamo or an
mhm,
NYC. But could it be in the mix? Sure. As an explanation of some things that some people were experiencing that are bizarre at
mhm,
certain times. Yes. And maybe that's another point I should make about New York. And I've talked to a good number of New Yorkers. You just don't have in spring 2020 all these people saying, I was suddenly sick.
mhm,
I was suddenly sick and I went to the hospital. People will say I was sick in November or October, or I had one heck of a flu in January. but we just don't hear these reports of sudden illness in New York City, which I find interesting.
Jonathan, do you know anything about there's some stories about northern Italy being targeted with flu shots the
Mhm.
year prior, and it supposedly being a very different flu shot that may have predisposed people to becoming ill?
Yeah, I mean, I've heard several people have made
Hmm.
that claim, and it's not something that I've particularly looked into. Although I know Jessica has a particular interest
Yeah, I mean, I
in the flu
think,
shot.
yeah, I do. I just think that the flu shot has not been looked into enough in general. And I would say since 2009 that there's a lot of evidence that there was a lot of messing around with the flu shot. There was a need, I think, to off-ramp the egg-based
Hmm.
platform. They have been pushing it on kids. There were a lot of mandates that people don't recognize had been par for the course in the United States for years before COVID. Not even always state level, but healthcare systems, right? Mask or vax was a thing in New York and Illinois if you didn't get the flu shot or you got a religious exemption. So, I'm for more mundane and direct explanations. I've been saying lately that the easiest way to kill somebody in a medical setting is with an injection of
Mm.
any kind. So I mean, even the ventilators, I've theorized that the ventilators were a cover for the drugs, and that
Mm.
they killed people who were already in the hospital. They sunk the damaged ships is a term I've used for it. And you inject heavy sedatives. I'm not saying people would have known that this is what they were doing, but
Mhm.
they activated maybe some kind of disaster medicine protocol, like a chemical attack plan, and they they were able to get some instant death. The military came in, removed bodies. I mean, there's a lot of, I know some of this kind of sounds crazy, but it's not stuff that I ever really thought of before. It's that the more data you look at and the more contemporaneous reports, you're like, wait a minute, did they run some kind of simulation even, but
Mm.
with real people? That's
Mm.
that's possible. So I'd like people to look into the flu shot more for 2019, especially. And, we had a flu shot in 2020. I don't know of any studies that look at people that got the flu shot in 2020 and then got the COVID shot and then got the booster and then got the flu shot the next year. And
I
then
mean,
do you know what I'm
there's
saying?
just there's
Yeah,
just a ridiculous assumption made that you can just carry on injecting more and more and more of this stuff into people
exactly.
that will never
Shingles.
interact and so on. But I mean, I will say a couple of things about the flu shot, and then I need to wrap up actually.
Yeah, I
But
do too.
because the first of all, the if you look into the vaccine efficacy estimates for the flu shot, they're always test negative designs,
Mhm.
and they're usually test negative designs for uh, they're not even for severe illness, hospitalizations, or death. They're just for reporting flu-like illness, which is kind of irrelevant. But the fact it's test negative means that if it actually increases the chance of getting something that doesn't test positive on the test you're looking at, it would miss that.
Right.
It's by nature of the design, and in fact, a lot of the COVID efficacy trials, COVID vaccine efficacy trials, were test negative designs as well, which are inherently um, flawed because if it increases the chance of harm from something you're not measuring, you will completely miss it.
Mhm.
That's the first point to make. The other point to make is that this fiction that we have, good flu year, bad flu year, and that's due to the strain of flu, it's completely mad as well because we know that influenza-like illnesses, it's a completely modeled, estimated construct how many ILRs there are, and we know that there are multiple pathogens that cause influenza-like illnesses, and suddenly we're meant to expect that this targeting this one strain of flu virus is the difference between success or failure of good or bad flu season, whether it gets it right or not. And it seems like it's a complete racket. The whole thing is that if you have a low ILI year, it's hurrah, the flu jab worked, and if you have a bad one, it's oh, we got the wrong strain this year. Better luck next year. And it's
Yeah.
kind of it's completely the whole thing is a racket.
And
Yep.
it ignores all the other things we know affect our health too,
Yeah,
like, air
Sure.
quality and
correct.
toxin exposure and all these things which could be contributing or your baseline health, right?
Yep.
Ah, I think the takeaway that I come to from your talk is that the data is incredibly polluted and complicated, and
Or missing,
or
unbelievable.
missing. Yeah, but definitely does not support the narrative
No,
in a conclusive
no.
fashion. And so, you go on, you're doing this incredibly important work, I think, of digging into what data can be uncovered, FOIA'd, um, and then put through some kind of analysis that helps us get a better picture of what happened.
Mm,
And I don't know if we'll ever get the answer, but I'm sure glad you're asking those questions.
thanks. Yeah,
Thank you.
I'd love for people to pester their public officials is what I would love.
Yeah, yeah. No, it's a really worthwhile question. In Hawaii, we had the same lockdown as much of the country. We had the lowest deaths in the country, but we had the greatest economic damage
Huh, sure.
across in the whole U.S. So, the price is exacted, I think, in different ways.
Mm,
Not to underplay deaths, of course, but um, this question of what happened at the beginning of this,
mhm.
all of this is so important, and I hope that everyone takes it upon themselves to look into this more. Go and check out Jessica's Substack. Go and check out Panda and Jonathan Engler's Substack, and yeah, let's learn more and spread the word with people and get more people asking questions.
Well, thank
Thank
you
you.
for having us on, and I'm sorry we overstayed our welcome. Uh,
No, thank you so much for spending the time.
thank you for everybody for hanging in there. So,
Thank
All
you.
right, have a great one.
okay,
Cheers.
bye bye.